There's no shortage of diets and weight loss plans. We've been talking about it this morning, but because so many people dream of reaching an ideal weight and looking better in their clothing, there continues to be great interest in diets.
I feel like I should be sucking in as I'm reading this. Dr. Jeffrey Gerber of Littleton Adventist Hospital in South Suburban Family Medicine joins us today. Doctor, welcome.
Thank you.
Thanks for joining us. So let's comment on this recent study, the comparison of weight loss diets published in the February edition of the New England Journal of Medicine. Talk about that, if you will.
Yes, well, the conclusions of the study were two, that all diets were the same, and then the calories that we consume are all the same, and those statements just don't make sense in the 21st century. And what we really understand is that the macronutrients that we consume interact differently with our body. Specifically, carbohydrates, more so than fat and protein, really stimulate appetite, weight gain, hunger through its response to insulin. And we know of many studies in the last 10 years that really demonstrate the benefit of carbohydrate-restricted diets. Now, unfortunately, the author of this study, who apparently favors the traditional low-fat, low-calorie diet, left out true carbohydrate-restricted diets. And had he included those types of diets, his results may have been different.
Why do you think carbohydrate-restricted diets work better?
To answer that question, you have to understand insulin resistance, and that's a condition where the body becomes resistant to the message of insulin, and it is really triggered by carbohydrate. That's what triggers the insulin levels and the insulin resistance, and it makes sense that if we were to remove the fuel, the carbohydrate, we would effectively treat the condition. And scientific studies definitely demonstrate that when you remove carbohydrates, you treat insulin resistance, weight, and all the problems associated with it.
So if you're thinking low carb, what roles do fat and cholesterol have in the diet?
Well, that's a great question, and we have spent 60 years attacking fat and cholesterol in the diet, telling people to avoid it like the plague, but yet we see that there is an epidemic of obesity, diabetes, and heart disease, so there must be something more to it. And the issue is that carbohydrates, especially refined carbohydrates, either eaten alone or in combination with fat and cholesterol, is the inflammatory factor. And in fact, if you're doing this diet correctly, you're going to be reducing carbohydrates, you'll be eating more fat and cholesterol, and if you're losing weight, you'll actually see an improvement in your cholesterol profile and all the markers of inflammation.
So in your experience in dealing with patients, what is the best way to control the appetite?
So the appetite is really a representation of a fluctuation in blood sugar and insulin levels and worsening insulin resistance. And again, it brings us back to the fuel, which is the carbohydrate. So if we want to control appetite, we will limit carbohydrate. And one of the best ways to do this is to teach patients about glycemic index, reducing carbohydrate content in the diet. And in a sense, the food is the medicine in terms of controlling that appetite.
Dr. Jeffrey Gerber, good information. Nice job. Thank you so much for joining us today.
My pleasure.
If you'd like more information, you can go to our website, thedenverchannel.com, and we'll post this interview this afternoon. Just give us a bit. You can watch it again. All you do is click